Happy holidays to you and yours. Because my words left you hurt and feeling unsupported, I want you to know I hear you, I see you, I believe you, and I apologize from the bottom of my heart. I am brokenhearted over this. If I could say it all over again, here's how I'd say it. When experiencing a health matter, keep a log of your concerns and symptoms so that you can provide them accurately to your physician. Have a buddy system, someone who can advocate for you when you're with a physician, especially when pregnant. I thank you for taking out time from your holiday to tune into my apology and my self-dedication to Black women and healthcare. I've been shaken and moved to be better.
Welcome to Prime Example. This is Cassie. So, Dr. Jackie of Married to Medicine was seen on video making some pretty defaming statements about Black women. She basically stated that Black women have a high maternal mortality rate because Black women cry wolf throughout their pregnancy. So, healthcare professionals don't know when to take their cries seriously. So these comments have sparked outrage across social media, with plenty of Jackie's patients coming forward and saying that she didn't take their complaints seriously when they tried to speak to her about an issue they were having. A lot of her patients were triggered by seeing her make these comments and realize, well, hey, this was why she treated me in such a way when I complained to her or needed an appointment. Now, these actions by Dr. Jackie are extremely unacceptable. And they're unacceptable for a lot of reasons. And the main reason is because if you're a doctor, you're being paid, so you're being paid to take them all of their claims seriously each time you see them. Otherwise, you're a fraud or committing malpractice. So instead of trying to deflect blame onto the victims, the healthcare system needs to take responsibility for these numbers. And Dr. Jackie pretty much tried to create a path for them not to accept responsibility for Black women's high death rate during childbirth. She tried to create a path where they didn't have to accept responsibility, and the responsibility could be projected onto the patient, onto the Black woman. How on God's green earth could a doctor's error that the patient complained about ever be the patient's fault? That is literally impossible. And she's insane to have even tried to think it was possible to make such an argument. So she deserves every bit of backlash that she is receiving for this. And now she's put out a letter and has now put out a video, which is still unacceptable, by the way, where she's trying to rephrase the comments she made. But I personally believe that she meant exactly what she said. She only feels bad because she's being called out for it. And furthermore, this whole thing, I don't care how professional she tried to make it sound, it came across as exactly what it was. It was an emotional outburst of her true feelings. She tried to make it sound professional, but that was a passive aggressive, emotional outburst where she expressed the contempt that she had for Black women who are her patients, and just Black women in general. Honestly, she stated exactly how she felt. So she deserves every bit of backlash that she is getting from this whole situation. She has clearly displayed her lack of empathy and the fact that because she doesn't have children and so she doesn't have a child of childbearing age either, she is 100% incapable of empathizing with the pain of her patients. She can't put herself in their shoes and displayed a clear lack of empathy. And as a doctor, I would imagine that that is extremely embarrassing. And that is why she's apologizing, because she's been uncovered, she's been discovered, not because she's sorry. So that's my take and my opinion on this situation. This is prime example. Like, comment, and subscribe.